Hi, guys. Welcome back to part two of sleep apnea and heart health with Michelle. I'm with Dr. Audrey Wells, the sleep doctor, the sleep MD, and I am so excited to talk about the different sleep apnea treatment options. And I'll have Dr. Audrey Wells, introduce herself one more time if you weren't here for part one, and we'll take it from there. Thanks so much for coming on air, Audrey.
Thanks, Michelle. I'm really happy to be here. I love promoting the sleep message and the importance of sleep, so this is my jam.
I love it.
I am a sleep medicine doctor. I've been treating people with sleep problems for about 14 years. And recently I've started a new company to help people in a group coaching setting. So sleep apnea folks are the first people that I'm trying to help.
I love it. I love it so much. So someone's diagnosed with sleep apnea. What are their options? Most people go straight saying, CPAP machine. So let's talk about CPAP machine. But let's also talk about all the other options, because I find a lot of people don't like the CPAP machine. We'll kind of talk a little bit of, not go deep dive, because I know this is a lot in your course, but a little bit of a smart tip for, well, how do we troubleshoot if we hate the CPAP, but also know there's other options for you, because sleep apnea is so important to treat for cardiovascular health, for overall health. And we need to make sure that your sleep quality is improved to really prevent heart attack, strokes, and chronic disease. So if you have sleep apnea, we need to treat it. And so let's learn about what are our treatment options.
Absolutely. So if I go on too long, you just give me a little sign here, because this is something I actually feel really passionate about. It's a pleasure to help people pinpoint what is going on with their sleep. And we have treatments for that. So turning someone's poor sleep into healthy sleep is one of the most rewarding things that I do. Here's the problem. That treatment option can fall flat. And a lot of people do associate that with using CPAP. So CPAP, which stands for continuous positive airway pressure, is the gold standard for sleep apnea treatment. And the reason is it works for those who can use it. So that's kind of the caveat, right? The way that it works is the air pressure acts as a stent to hold your throat open during sleep. And this is important because when you think about sleep apnea, I want to emphasize that sleep apnea is a breathing problem, and it happens to occur during sleep. But CPAP solves that breathing problem by preventing the airway obstruction. And it's a multi-level stent, and that's important. And I'll tell you why in a minute. The CPAP treatment, I think the big obstacle is people think about a mask on their face. And when they describe it, it's like this, right? I try to say, that Top Gun movie that's coming out, you could be a fighter pilot, right? But first, I want to say that there's actually 3 different types of CPAP masks. And what people usually associate with CPAP is a full face mask. So it goes over the nose and mouth. That's really good for people who breathe through their mouth only, because the mouth is contained within the mask. But the 2 other types can be easier to acclimate to. One type fits just over the nose, and then a 3rd type just comes up to the nostrils, and that's the smallest kind of CPAP mask. So you have the mask, you have the air pressure coming through the mask, and the pressure is generated by a little machine that sits on the side of your bed. The air is humidified. The machines have come a long way with quietness and size and different things. So I think we've made progress. And there's been a lot of effort over the years to come up with an alternative to CPAP that was really viable. And certainly I'm always on the lookout for that, because when I first started in sleep, I was like, come on, are you kidding me? Like, air pressure into your throat, that's the best we can do. Well, that's the best we can do. And I think
So with those CPAP machines, would you describe, I think a lot of times there's this fear behind even using it. So a lot of my clients are diagnosed, some of them are diagnosed with sleep apnea, and they are like, I can't use the CPAP machine. It's just not comfortable. It's not like some people are scared to use it. So can you describe, is it going to impede on my ability to fall asleep? Is it a strong pressure? Is it a light? Is it continuous? Is it cold? Is it warm? How is that gauged? Because I think a lot of times people are like, oh, you have sleep apnea. Your sleep apnea machine will be, your CPAP machine will be mailed to you. There you go. And it's not properly fit on them. It's not, it's scary. There's so many emotions that aren't properly addressed when someone gets diagnosed with sleep apnea. So if you can speak a little bit to that, I think it might help certain people who have a CPAP machine next to them, but don't know what to do to kind of get a little more acclimated.
This is a major care gap that I am trying to address, because when somebody gets diagnosed with sleep apnea, I think there's sort of a flood of information that comes at them. And on top of everything else, they're prescribed a machine that they have to bring into their home. So psychologically, it can be a lot.
Yeah.
And if you add a component of anxiety at night when you're trying to fall asleep, that is incompatible with sleep. Yeah. So already there's this resistance to the whole idea that I need to use this thing. It's going to force air into my throat. And there's a lot of mindset work that I do with patients or clients to help them overcome that so that they can fix their sleep. That's the point. I think, to answer your question about the pressure is purposely very gentle. It actually doesn't feel terrible. And we can do a lot with the settings of the machine to start low. The machine technology can respond to what a person is doing during their sleep. For example, if they have more airway obstruction when they're sleeping on their back, the machine can ramp up to give support to that airway. And I'm choosing that word carefully, because it's not forcing air, it's actually just supporting the airway.
Yeah.
Yes, it's humidified. You can make that cold or warm depending on your personal preference. So there's a lot of customization that's available now. And, people who struggle with anxiety or a feeling of claustrophobia with something on their face do need extra care and sort of a high touch response to help them over those humps. In general, treating your sleep apnea with CPAP means you're going to have a little bit worsening before you acclimate and things get a lot better.
Gotcha. I think that's really important. I think a lot of times you're told just to do this and there's not that, personal approach to, well, how does it work best for you? And making sure that it does fit your face properly. All the settings are where you need it. And also, like you mentioned, knowing that it's going to be a little bit of an adjustment. So it's not going to be instantaneous. If someone wears it for 2 or 3 nights and they're like, oh, I don't feel like I slept better. I felt like I slept worse. I'm just going to give this up. It's important to, continue it and really make sure you're getting that personal customization of the device so that it works for you. And I think this is probably why CPAPs are so, poo-pooed by so many people, because they try it once and it makes them feel worse. If something made you feel worse, you're not going to continue doing it. And so I really appreciate that you mentioned those things, because I think a lot of people might be blindsided by it and aren't. No one has been telling them this, and it's really important information. So that's great.
The psychological preparation helps a lot.
Yeah.
What I like to tell people is, like, depending on who's sitting across from me, it's like finding the bra that you love, or it's like finding the jeans that look great on you. There's a trial and error process that happens until you finally kind of get in your flow and get it right for you. But, that signaling and that relationship that happens between the person and their sleep doctor, or the person and their medical equipment company, there's things that can get lost in the mix. And I understand it can be frustrating.
Definitely. So let's say someone try the CPAP. Well, before I even say that, is there any person who would be contraindicated to use the CPAP machine? Is there anyone who shouldn't even try it or should avoid it because of X, Y, or Z?
It's actually pretty rare. So there are some people who have retrograde airflow through their tear ducts into their eyes. And sometimes that prevents the use of CPAP, although there is a special type of CPAP mask where the eyes are actually in the mask. It looks like an astronaut. There are some people who have worsening or develop a different type of sleep apnea with CPAP, and that's something that makes the follow-up with the sleep specialist after you start therapy really important, because we're always screening for that. I want to say that a lot of times the insurance company will direct people to CPAP treatment because that's the only thing that's paid for by insurance. So that oftentimes plays a role in a person's decision-making about what sleep apnea treatment to go after.
Gotcha. Okay. That's helpful. So CPAP is the gold standard. What comes after that in terms of different modalities?
Yeah, it depends a little bit on the severity of sleep apnea. So for people who have moderate sleep apnea to severe sleep apnea, I would certainly recommend CPAP as a starting place. And it's not my position to say that CPAP is for every single person. For some folks, I can tell them with an in-lab sleep study whether their sleep apnea is only occurring when they sleep on their back. And that's very important information, because there are sleep aids. They're like physical barriers that you wear around your chest. It's sort of like a neoprene belt. And it's called a sleep positioning device. And it's great for people who only have sleep apnea on their back because it keeps them from rolling onto their back during sleep. So that might be a fix for those folks. For people who have mild and sometimes moderate sleep apnea, an oral appliance therapy can be very effective. Sometimes it's called a mandibular advancement device. And this is made by a dentist trained in sleep medicine. I would strongly recommend not going with an over-the-counter boil and bite thing. But this is a custom oral appliance that pulls the jaw forward a bit, and that helps open up the airway caliber. Now, it's good for sort of the lighter ends of the spectrum where sleep apnea is concerned, because if you can only have so much forward jaw movement before you start running into problems at your joint here. So for folks who have moderate to severe disease, that probably isn't enough forward positioning to overcome that. But I will say that for some people who require a very high CPAP pressure, using the combination of the oral appliance with CPAP allows for a much lower CPAP pressure setting, and that's a benefit.
I love that. But I think it's also important because I've seen this also happen where a dentist who specializes in sleep apnea will give an oral appliance. But I think it's important to first assess how severe your sleep apnea is, because that's not necessarily going to benefit you. And we need to make sure that it works specifically for you.
Correct.
Yeah. Okay, great. So we have CPAP, we have our oral appliances, we have those devices you mentioned. Is there anything else when all of those just don't work for someone?
So surgeries, everybody is asking about the Inspire treatment. And this is, the technical term is a hypoglossal nerve stimulator. Inspire was actually developed here in my state of Minnesota. And this is a device that was sort of in test markets for a long time. It's starting to become more used. And I want to tell people that despite all of the marketing you may be exposed to, there are some hoops to jump through before you're eligible for Inspire. So for example, your sleep apnea has to be this severe, but can't be more severe than this. So there's a range that you have to fall into. Your body mass index is also capped off at about, I think it's 35. So your body mass index has to be 35 or below in order to be eligible. And you have to have a certain type of sleep apnea, so mainly obstructive sleep apnea. You can't have centrals, which is a different type. A lot of insurances require the sleep study to be within the last 2 years. And it's not clear that every insurance is going to pay for a new sleep study just to get the Inspire device. The last thing I want to mention is that in order to be eligible for Inspire, if all of those criteria check the box for you, you still have to have what's called a sedated endoscopy to look at the pattern of airway collapse. So there's a specific pattern of airway collapse that would make you eligible.
Gotcha.
If you go through all of that, then the next thing is who is going to do the procedure. And in most states, there's somebody who's certified to do the Inspire device. And what it consists of is a pacemaker-like device. They put it in the right chest so that they save the left chest for a cardiac pacemaker. And then there's an electrode that's snaked up through and placed at the base of the tongue. That electrode, when the device is on, pushes the tongue forward during sleep, and that's how it treats sleep apnea. The Inspire device doesn't have a 100% success rate. So it is possible to go through all of that and get tested and still have sleep apnea. The study populations are a bit limited right now, so I don't want to really place a number on what the success rate is, but suffice to say, just like any medical treatment, it's not 100%. It is something that I think a lot of people are excited about, and I'll be keeping my fingers on the pulse of the Inspire device as time goes forward.
Interesting. That was so informative. I really appreciate all of that really great information. So any last words or anything that you would like to share with us before we conclude this part 2? I really enjoyed our conversation. I love learning about sleep apnea from, part 1 in how do we detect it? Why is it important, to here where we really discuss the different modalities and knowing that, if CPAP doesn't work for you, it might also need a little bit more troubleshooting in order for it to work for you. To all these great, tips. I really appreciate your time and you sharing all this great information with us. But any last words you want to share with the audience, or one last takeaway that you want everyone to kind of know?
Yeah, I really want to say, for anybody who's struggling with their sleep or with sleep apnea treatment, don't give up. There is something out there for you. There is some way to get it. And I really feel passionate that sleep is good medicine. So if you want to protect your health, do your best to have great sleep quality.
I love that. Sleep is a pillar of heart healthy living, and we have to make sure we prioritize it. Thank you so much for your time. And everyone, feel free to check out Dr. Audrey's website at supersleepmd.com. And I look forward to seeing you in the next episode.